Hello all, this is Dr. Gaurav Tiwari, board certified cosmetologist practicing at Botocosm, Banglore. Most of my patients have asked me about what are the methods that are available to them for hair transplantation. So basic hair transplantation involves from a non-surgical aspect to a surgical aspect to a synthetic hair. I'll give you a brief explanation about it. Most of the patients who are not able to afford surgical procedures or not indicated for a surgical method, we have an option of giving them as a wig or a fiber or a synthetic hair, or which is mostly human made or synthetically made, which can be attached to their scalp, and within 1 hour time they can restore their hair. So the easiest way of doing a hair restoration is called as hair patch or wig, which does not contain any kind of surgeries but as considered as a method of hair restoration. Then in our olden days and even now, there is a practice of FUT or called as follicle unit transplantation. In this method, we harvest a strip of grafts from the back donor area of the scalp and prepare individual hairs and extract them and implant them, and also there will be a suture at the back which will be joining this grafted area which is being detached from the scalp. It's mostly surgical and there is a little downtime, more healing time, which take approximate 2 to 5 days up to 7 days, and an overall healing might take up to 14 days to 20 days in kind of FUT transplants. There is a limitation of 3000 to 4000 hairs in FUT transplant. The second method that we have is also called as FUE method or a follicle unit extraction method. Here we are able to choose more number of hair, and over FUT it is preferred method in recent practice because surgical suture cutting stripping is avoided in FUE method. There will be small punches which will be made to the donor area, which will be used by a sharp punch. So scarring can be reduced with FUE. The number of grafts can go up to 4000, 6000 hairs depending on the availability, and the downtime healing time is also like 2 to 4 days usually, and overall healing can be achieved within 1 to 2 weeks itself. Another method which is available for restoring hair with some patients who are not able to have the enough amount of donor area. I mean that if the back area is so much shrunk that the availability is only 3000 graft and the requirement is about 7000 hairs, it means it's almost grade 7 and the quality of donor area is also very thin. These kind of patients can opt for the latest technology which is called as biofiber. So biofiber is an implant method which is a newer generation method of hair implants. The approximate cost of these implants are in the range of 85 rupees to 165 rupees depending on the length of the fibers that the person is wanting to go, 15 centimeter or 30 centimeter length, and it can be styled once. So there is a little advantages over wig, that it is not to be maintained, not to be removed, and not to be glued again and again. Once it is incorporated, it lasts good for 5 to 10 years. And even in future, if there is hair fall which is notable, we can always top up more number of hairs in biofiber case. So biofiber is also coming as a very trending way of hair restoration in the upcoming days with people having busy schedule. Biofiber also has a very least downtime. Immediate results can be seen. There is no waiting time of 4 to 6 months. The healing period of the scalp is maximum 24 hours to 48 hours. The person can go back to work. So this is the most advanced method of hair restoration available for people who are having no amount of hair in the total scalp or having very less amount of hair, where there is very less chance of removing hairs from the donor area and incorporating it into the recipient area.